Mistreatment of medical students is one of those things that you hear a lot about, but you might not know what the term mistreatment really means. When you think about how you treat students, you're pretty certain there's no mistreatment. But is it happening elsewhere? At Brown? What about at other medical schools? And what specific behaviors are considered mistreatment? In this video, we're going to go over the definition of mistreatment and show some data about student mistreatment here at AMS and nationally. Every year, graduating medical students across the country fill out a survey from the AAMC called the Graduation Questionnaire, or GQ. The GQ is long and gathers student feedback about all aspects of their undergraduate medical education, including mistreatment. For example, in one section, students are asked to indicate the frequency with which they have personally experienced a series of behaviors, such as being publicly embarrassed or humiliated, being threatened with physical harm or being physically harmed, being required to perform personal services, and being subjected to unwanted sexual advances. Students are asked to include in their responses any behaviors by faculty, nurses, residents, institution employees, and other students. Their answers do not include behaviors of patients. Let's take a look at how graduating students responded to these questions in 2019. We're going to focus on these top two rows, data from all medical schools and the most recent data from 112 AMS graduates. As you can see, almost 27% of AMS graduates responded that they'd been publicly embarrassed once during medical school, compared with 20% nationally. Around 21% reported being publicly embarrassed occasionally, similar to other medical schools. There's some debate, perhaps even in your own mind, about embarrassment being a fairly benign or subjective emotion, and thus a question about its inclusion in the list of behaviors considered to be mistreatment. However, we can all agree that public humiliation is not conducive to learning, and should never be a part of how we treat our students. In 2019, 15% of AMS graduating students reported being publicly humiliated once, and almost 10% indicated experiencing this occasionally. That's 17 of our students indicating they've been humiliated once, and an additional 11 individuals indicating occasional public humiliation. 5 of our students indicated that they've been threatened with physical harm. 5 of our students indicated that they've been asked to perform personal services once or occasionally, and a total of 9 of our students were subjected to unwanted sexual advances. Thankfully, none of our students reported being asked to exchange sexual favors for grades or other rewards. Additional questions ask students how they have been treated in terms of gender, race or ethnicity, and sexual orientation. 11 individuals report having received lower evaluations or grades, solely because of gender rather than performance. 30 individuals reported being subjected to offensive sexist remarks or names, 17 of whom indicated this happened multiple times. 9 individuals report having received lower evaluation or grades based solely because of race or ethnicity rather than performance, and 19 individuals report being subjected to racially or ethnically offensive remarks or names. For 13 of our students, this happened multiple times. 2 individuals report having received lower evaluations or grades based on sexual orientation, and 6 individuals report being subjected to offensive remarks or names related to sexual orientation. The GQ also asks about treatment based on other personal beliefs or characteristics. This could potentially include something like a student's political views. 15 of our students indicated that they had been subjected to negative or offensive behaviors based on these other beliefs or characteristics. Excluding the issue of public embarrassment, 54.5% of our 2019 graduates, that's 61 individual members of our medical school community, reported personally experiencing the behaviors we've just discussed. This was higher than the national percentage of 40.4%. According to our graduates, these behaviors were perpetrated most often by clerkship faculty in clinical settings, residents or interns, and nurses. So what is mistreatment? Mistreatment is not using questions to assess or expand students' knowledge. Mistreatment is not having high expectations for the amount or quality of student work. Mistreatment is public humiliation, threatened or actual physical harm, requests to perform personal services, engaging in unwanted sexual advances, and discrimination based on gender, race, ethnicity, sexual orientation, or other categories, which includes sexist, racist, or other offensive remarks. Student mistreatment should not be tolerated. Here at Brown, our goal is 0. 0% of students experiencing mistreatment frequently. 0% experiencing it occasionally. 0% of our students experiencing mistreatment just one time. We need your help. In a different video, we will go over in more detail the suggestions below to improve the learning environment, and we'll talk about how mistreatment is reported and addressed. Thank you for all that you do to support and teach our medical students every single day. Your contributions to their education and to the Brown community are so important and so valued. With your help, we can reach our goal of getting to 0.